In emergencies, every second counts. The urgency of the moment can be overwhelming, and knowing what to do can make all the difference. Knowing the right first aid can be the difference between life and death. Immediate and correct action can stabilize a person until professional help arrives. Unfortunately, many common first aid practices are based on myths. These misconceptions can lead to ineffective or even harmful interventions. These myths can be harmful, even deadly. Misguided actions, though well-intentioned, can exacerbate injuries or delay proper treatment. It's crucial to separate fact from fiction. Understanding the correct procedures ensures that we provide the best possible care in critical moments. This essay will debunk common first aid myths and provide accurate information. By educating ourselves, we can be better prepared to handle emergencies. We've all heard them, home remedies passed down through generations. These stories, while often shared with good intentions, can sometimes be misleading. While some hold a grain of truth, others can be downright dangerous. It's important to critically evaluate these remedies before applying them. Remember, proper first aid is about providing immediate care, not performing miracles. It's about stabilizing the situation until professional help can take over. Always prioritize seeking professional medical help when needed. Knowing when to call for help is as important as knowing what to do in the meantime. Knowing the correct procedures can empower you to act confidently in emergencies. Confidence comes from knowledge and practice. It's about protecting yourself and your loved ones. Teaching these skills to family members can create a safer environment at home. Let's delve into the world of first aid myths and equip ourselves with the knowledge to act swiftly and effectively. Accurate information is our best tool in emergencies. Remember, your actions can make a difference. Every bit of knowledge you gain can potentially save a life. By dispelling these myths, we can create a safer environment for everyone. Community education and awareness are key to effective first aid. Let's learn together and become informed first responders. Together, we can make a significant impact in emergency situations. One of the most persistent first aid myths involves foreign objects in the eye. Many believe that removing an object yourself is the best course of action. However, this can cause further damage. The eye is delicate and prone to scratches. The only exception is an eyelash on the surface. Even then, proceed with caution. Wash your hands thoroughly, locate the eyelash in a mirror, blink rapidly to produce tears. Then, try to remove it gently with a wet cloth. For anything else, seek immediate medical attention. Do not rub your eye. Cover the injured eye with a clean cloth or eye patch. This will help prevent movement and further injury. Remember, when it comes to eye injuries, it's always better to err on the side of caution. Prompt medical attention can prevent complications and ensure the best possible outcome. Another common misconception involves wound treatment. Many people believe that applying ointments or creams is the best way to promote healing. However, this is not always true. In some cases, it can even hinder the healing process. The best way to clean a minor wound is with cool running water and mild soap. Gently pat it dry with a clean cloth. Avoid using hydrogen peroxide or rubbing alcohol, as these can damage the surrounding tissue. Cover the wound with a sterile bandage to prevent infection. Change the bandage daily or if it becomes wet or dirty. If you notice signs of infection such as redness, swelling, pus or fever, consult a doctor immediately. Remember, proper wound care is essential for preventing infection and promoting healing. By following these simple steps, you can help your body heal naturally and avoid complications. Section 4. Fever phobias. Keeping your cool. Fever is a common symptom of illness, and many myths surround its treatment. It's important to understand what works and what doesn't. One persistent myth is rubbing alcohol or vinegar on the skin to reduce fever. People often believe these substances can draw out the heat. This practice is not only ineffective but also potentially dangerous. It can cause more harm than good. Alcohol can be absorbed through the skin, especially in children, leading to alcohol poisoning. This can result in serious health issues. Vinegar can disrupt the body's natural pH balance, causing further complications. It's not a safe remedy for fever. The best way to manage a fever is to focus on keeping the person comfortable. Comfort measures are key. Dress them in light clothing and provide plenty of fluids. Hydration is crucial for recovery. A lukewarm bath can also help reduce body temperature. It's a gentle and effective method. Over-the-counter medications like acetaminophen or ibuprofen can be used as directed, but always consult a doctor before giving medication to children. Proper dosage is essential. Remember, fever is a natural response to infection and most cases resolve on their own. It's the body's way of fighting off illness. Focus on supportive care and seek medical advice if the fever persists or is accompanied by other concerning symptoms. Always prioritize safety and well-being. Section 5. Fainting. Don't get floored by misconceptions. Fainting or syncope is a sudden loss of consciousness caused by a temporary drop in blood flow to the brain. It can happen to anyone, anywhere, and at any time. While usually harmless, knowing the correct first aid for fainting is crucial. Immediate and appropriate response can make a significant difference in the person's recovery. One common myth is to lift the person or sprinkle them with cold water. These actions are not only ineffective, but can also cause more harm than good. Lifting a fainting person can be dangerous, especially if they are larger than you. It can lead to injuries for both the helper and the person who fainted. Sprinkling water on their face is also ineffective and can be uncomfortable. It does not address the underlying issue causing the fainting. The correct action is to help the person lie down on their back and elevate their legs above heart level. This helps restore blood flow to the brain, loosen any tight clothing, and ensure they have plenty of fresh air. This can help the person regain consciousness more quickly and comfortably. Stay with the person until they recover and call for medical assistance if they don't regain consciousness within a few minutes. Monitoring them closely is essential. Remember, fainting can sometimes be a sign of a more serious underlying condition. It's important not to dismiss it lightly. It's essential to seek medical evaluation, especially if fainting occurs frequently or is accompanied by other symptoms. Early diagnosis can prevent potential complications. Section 6. Burn beliefs. Avoiding common pitfalls. Burns are a common household injury and many myths surround their treatment. One such myth is applying butter or sour cream to soothe the burn. While these substances may provide temporary relief, they can actually worsen the injury. Butter and sour cream can trap heat, increasing the risk of infection. The best way to treat a minor burn is to cool the affected area. Hold the burned area under cool running water for 15 to 20 minutes. Avoid using ice as it can further damage the skin. After cooling, cover the burn with a sterile non-stick bandage. Do not break any blisters, as this can increase the risk of infection. For severe burns, seek immediate medical attention. Remember, burns require prompt and appropriate care to prevent infection and promote healing. By following these simple steps, you can help minimize damage and ensure the best possible outcome. Section 7. First aid awareness, your key to safety. In conclusion, debunking first aid myths is crucial for ensuring the safety and well-being of ourselves and those around us. By replacing outdated practices with evidence-based information, we can respond to emergencies more effectively and potentially save lives. Remember, this essay is not a substitute for professional medical advice. Always consult with a healthcare professional for any health concerns or before making any decisions related to your health or treatment. Enroll in a certified first aid course to gain practical skills and confidence in handling various emergency situations. By staying informed, remaining calm, and taking appropriate action, we can make a difference in emergency situations. Let's prioritize first aid awareness and create a safer environment for everyone.